41 and getting fillers for my jowls and marionette lines. Would laser treatment help overall laxity? Not ready for a full lift. I'm happy with my volume, but want to firm things up. My under eye bags may require a blepharoplasty, but wondering if laser treatment would be enough for those as well. Which treatment is best for firming up the skin? I don't think it's time for a full facelift, possibly a lower facelift to help with my jowls. Just not sure if I should try laser or go ahead with a lower or mini lift. The filler for my jowls make my lower face fuller than I like, but it's a trade-off.
Thank you for your question. You submitted your question with a single photo, and you state you're 41 years old and that you are concerned about the marionette lines, the jowl, the overall skin laxity, and that you're aware that you have under eye bags, and you're stating you're not quite ready for a facelift, and you're concerned that injectable fillers can make the lower part of your face look wide. And so you're asking, can laser essentially improve these areas? And I think you are looking to get some clarification as to a strategy. Well, I can certainly share with you how I discuss these concerns with my patients, which is essentially every day, all day in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, customizing solutions using lasers, injectables, as well as surgical and other non-surgical options is what we spend all day doing to help our patients. And it is very much the questions that you're asking reflective of the current state of options in the aesthetic field. Thanks to a lot of very aggressive marketing between manufacturers of various devices and products, as well as the different interests of different types of medical and non-medical providers, it creates quite a lot of confusion. So I think that just by looking at your photo, and I would tell you that it is unlikely that you would be a good candidate for a facelift at this stage. Basically, having done a lot of facelifts in my career and continuing to do so, the reason why a lot of patients will first consider a facelift is that when they pull their skin upward or do what's called the mirror lift, things look better. But the reality is that unless the skin moves significantly, and essentially what you're trying to do is improve the jawline and neck through that action, at this age, usually this is not the right time. Now, that doesn't mean that it's not possible. My youngest patient I ever did a facelift for was 37 years old, but that was more of a limited facelift as opposed to a type of facelift that we do with someone who typically gets a facelift who tends to be in their 60s and older, which is more of a face and neck lift. So it's very important before defining the solutions is to define the problem. And you define the problem by going down to the core basis, which is anatomy. So what happens at 41 that's different than what you looked like when you were 31? Well, there's two basic issues. One is volume loss in the bone level as well as in the fat and soft tissue level. This is what implies that there is laxity. That's why when you pull, you feel like there's loose skin. But imagine if the foundation has diminished, then the covering will get loose. Now, certainly there is no shortage of lasers that can help with this overall situation. But I understand your concerns about the use of fillers. Fillers traditionally are used in a way to chase lines. Basically, if you have a nasolabial fold that's deep or marionette lines that are deep, you get fillers to soften those lines. but generally speaking, the lines are really more of a reflection of a global change and more of a symptom. We offer a procedure in our practice called structural volumizing, and this is probably relevant to your situation. The concept of structural volumizing is the application of fillers, but placing fillers at a deeper level, basically on the bone structure, so that the underlying bone and the muscle overlying the bone work together in a way that creates restoration of some of that lost volume that I described earlier, the loss of bone as well as fat. What's nice about this approach is that the skin does not get weighed down by the volume of filler. A lot of times people don't like the results that they see of people who have had fillers because they can look rounded or they can look widened. But with structural volumizing, you can actually enhance and balance a lot of the angularity that could be missing. In fact, there is something called the golden ratio, which is something that in nature is seen as very attractive. So when you compare, and you see this in models, you look at the cheek structure relative to the jawline structure, and it's like a 1.6 to 1 ratio. So you can potentially consider this, and this also applies to the profile, so that the jowl areas and the cheekbones can also be enhanced. When this material, such as a long-lasting HA filler or hyaluronic acid filler, such as Juvederm Ultra Plus or Juvederm Voluma, is placed at this level, the material can last over 1 year. So there's also a very nice benefit in not needing frequent reapplication. Now that being said, where does laser fall into this? As far as your under-eye bags are concerned, laser really will not get rid of the under-eye bags. There are lots of different types of lasers, and there are certainly ways to try to do things that can help soften the under-eye bags, but depending on the degree of the under-eye bags, and the under-eye bags represent something called lower eyelid fat prolapse. Depending on the degree of the prominence of the under-eye bags, we can soften their appearance by using injectable filler such as Restylane or softer hyaluronic acid filler, or we do a procedure called transconjunctival lower eyelid blepharoplasty, where the fat pockets are actually reduced so that they don't bulge out. This requires more of a physical examination, but these are options that I think would be more effective than laser. So where does laser fit in? Laser does fit in to help skin quality and texture. It can, the spectrum of lasers we have can essentially do a lot for pigmentation, for vessels, and for skin quality, and limited in terms of skin tightening. Generally speaking, I find that when you restore volume, then tightening is less of a priority for the patient who wants to initially come in asking to be tightened. Basically, I look at skin as more as the icing, like what we do after everything else is done. Too many people keep trying to use lasers or thermal energy devices to be substitutes for surgical procedures or other procedures. But you can only do so much, and you have to remember the skin is about 2 millimeters in thickness. There's not a lot of room to work with, and you can only do so much. But that doesn't mean we in our practice have several different kinds of lasers that provide solutions for everything from wrinkles to pigmentations to vessels and a lot of other things, including skin tightening. But we have to use them as tools appropriately. So meet with a qualified, experienced physician who can review these issues with you. Make sure you spend a lot of time in analysis so that you would be able to get a sense of what the strategy makes the most sense to you in terms of your resources, in terms of your time, and in terms of expected outcome. So I hope that was helpful. I wish you the best of luck. Thank you for your question.